Okay, let's talk about difficulty sleeping, also known as insomnia. Insomnia is something that we see a lot of, and it's often something that gets brought up at the very end of the visit, like an afterthought. The reason for this video is to make sure I do a thorough job of explaining the concept of insomnia and what can be done about it, both in terms of medications and in terms of what we call sleep hygiene. Now, there's all kinds of reasons why people struggle to fall asleep or stay asleep at night. I'd say the more common root causes are related to anxiety or environmental stress factors, like having extra stress at work or with the family. When it comes to anxiety and life stress, often people will say they simply have a hard time shutting down their brains at night, and they'll lay awake thinking about all the events of the day or what needs to be done for tomorrow. Other common issues that can lead to insomnia include things like having some type of chronic pain, or you might find yourself having to wake up at night several times to urinate. Whatever the cause, it's important to figure out what's the root cause and then brainstorm ways to overcome those forces, whether it be lifestyle adjustments or medications. For example, if you get up at night a lot to pee, you might try not drinking so much fluid past 5 p.m. Or if you're a man, you might want to have your prostate evaluated. If you're a woman, this might mean getting tested for overactive bladder. If you have anxiety, you might try going for a walk in the evening by yourself and use that time to process some of the emotions and thoughts, or you can consider counseling. Still, there's other reasons why people might not get a good night's sleep, such as having things like sleep apnea, which is an anatomic issue with moving air in and out of the lungs, and it's a condition where you stop breathing at night. The typical person who has sleep apnea is a person who's obese, who snores, wakes up feeling tired, even when they've had a normal amount of sleep, and they might wake up with a headache in the morning. If you have these symptoms, make sure to let me know. But whatever the cause, I think the first step is being just real honest with yourself and take a good self-inventory on what are the root causes of your sleep problem. Also, there's some basic treatment principles that tend to help everyone, and it's important that you understand these on the front end. Again, in medicine, we call this sleep hygiene, and I've inserted a little video here from Johns Hopkins that I'd like you to watch.
Sleep hygiene. Are you having trouble sleeping? Do not feel alone. Almost 20% of Americans report difficulty falling asleep and/or staying asleep. Of those, about 10% describe it as a serious problem. Often sleep can be improved by simple changes to sleep-wake patterns and practices. We call these changes improving your sleep hygiene. Although the basic rules of sleep hygiene may seem like common sense, they are often overlooked. Important issues for good sleep hygiene. Sleep schedule. Our bodies are designed to be synchronized to the daily cycles of sunlight and darkness. If our bodies get out of tune, the peaks and valleys of body temperature, hormone production, and digestion occur at the wrong times of the day. This lack of synchrony interferes with sleep and lessens daytime alertness. It is important to get up about the same time each day, even on the weekends, to help your body maintain a daily rhythm that is in tune with the 24-hour light-dark cycle. Because exposure to light in the morning is so important for synchronization, sleeping in too long on your days off can cause your internal body rhythms to drift. Sleep efficiency. An efficient sleeper is someone who is asleep most of the time they are in bed with the lights out. If you are awake for a large part of the night, perhaps you're spending too much time in bed. Try going to bed a little later or getting up a little earlier. Sleep environment. Light reading and relaxing music can set the stage for a restful sleep. Watching upsetting or stimulating programs on television can have the opposite effect. Only use the bedroom for sleep and sex. Try to keep stressful activities such as paying bills and having serious discussions out of the bedroom if possible. Frequently, pets will interrupt normal sleep patterns. They often have their own schedule that might not match with yours. Some couples find that they sleep better if they have separate bedrooms. A sleep partner can affect the quality of your sleep by keeping you awake or interrupting your normal sleep cycle. For example, does your bed partner snore? Most people who snore are not aware of it, so it is up to you to let them know. If possible, bed partners should keep the same sleep schedule. This may require some give and take since work schedules and natural preferences can be different. Occasionally, couples that have schedules that do not overlap choose to sleep separately for the sake of a good night's sleep. Caffeine, alcohol, and tobacco. If you are having trouble with insomnia or difficulty sleeping, it may be related to caffeine, alcohol, or tobacco use. Try limiting your total caffeine use to no more than 2 caffeinated beverages per day. Remember, in addition to coffee, many soft drinks have large quantities of caffeine. Do not drink beverages with caffeine after 12 noon. For some, the caffeine effects from a morning cup of coffee are not out of the body until nightfall. Switch to decaffeinated beverages. Good quality decaf coffees are hard to tell from caffeinated ones. Alcohol can also affect a good night's sleep. A drink close to bedtime may make you sleepy, but as it wears off, there is a rebound alerting effect that can prevent good sleep. Be cautious and on the low side in your alcohol intake, especially in the evening. There are many reasons not to smoke, and your sleep is one of them. Nicotine has a stimulating effect and prevents sleep. Some smokers have to wake up during the night for a cigarette. Exercise. There is good evidence that regular exercise improves restful sleep. Although exercise is great, avoid working out too close to bedtime. Exercise gets your adrenaline going and makes it hard to sleep. Napping during the day. Most adults cannot sleep more than 7 or 8 hours per 24-hour period. If you nap during the day, it is subtracted from your nighttime sleep. A short nap is harmless for most people and may be refreshing. However, naps lasting longer than 30 minutes may cause you to wake up feeling groggy, and you might have trouble sleeping at night. Anxiety over insomnia. It is normal for some nights to be better for sleep than others, and to have an occasional night with insomnia. Lying in bed worrying about whether or not you're getting enough sleep will only make matters worse. If you are unable to fall asleep, get out of bed and do some quiet activity, such as reading, until you are sleepy.
Okay, now let's discuss the different medications that we use for insomnia, and I'm going to start with the least potent and then proceed to the most hard-hitting. So one thing I want to mention before we get too deep into this is that more than any other condition that we treat, I feel like there's so much variability with how people respond to different sleep medicines. So sometimes we have to work through a few different medicines before we get the right one. For example, I might see a husband and a wife who both have insomnia, and I'll mention trazodone, and the husband will look at me and say he's already tried it and it didn't work for him, and then the wife hears that and immediately thinks that medication is garbage, right? So it's a shame because everyone is so different when it comes to sleep medicine. It's definitely not one size fits all with this, and a lot of it has to do with not everyone's root problem is the same. Also, the side effects of these things are so variable. So if you have a cousin who took Ambien and he would sleepwalk at night and eat an entire can of Pringles, that doesn't mean that's going to happen to you, okay? I've done this long enough to hear all the stories on every medicine. None of these medicines are perfect. Okay, let's talk about the medicine. So first, I'm going to list the medicines that I normally use. Hydroxyzine, trazodone, gabapentin, Ambien, Belsomra, Quviviq. I really don't tell people to use melatonin because I figure if you're here asking me about insomnia, you probably already tried that and it didn't work. But having said that, if at any point you can use melatonin, I would suggest using 10 milligrams, taking it about 30 minutes before bed. And if one of the medicines that we give you doesn't really seem to be working quite enough, you can always add melatonin to that. That's okay. My inclination on this is to try people on the most gentle and safe medicines first, and then if those work, great. And if they don't, then we just start marching down the list. Okay, so let's talk about trazodone. Trazodone sounds like a scary name, but actually it's sort of the sleep medicine equivalent to like Mr. Rogers. It's gentle, it's calming, it has the benefit of not being addictive. Trazodone was originally developed to be a depression medicine, but it made people feel sleepy and it helped them to relax. So it was kind of rebranded into a sleep medicine, and it works really well. It's got a very low side effect profile. The way it works is it increases the serotonin in your brain, which is a chemical that's naturally released in your brain when something good happens to you, like if you're in school and you got a good grade on a test, or that feeling that when you wake up and you find that school is canceled because it's snowing. It helps your body just to feel comfortable, to relax, and to kind of focus on happy thoughts, not stressful ones. You take this one about 30 minutes before you go to bed, and you can take it every night if you want to, or you can take it as needed. In terms of side effects, sometimes people feel a little bit groggy the next morning, and if you experience that, one trick is just to take it earlier in the evening, because the problem is that your body is probably just taking a little bit longer to break it down and clear it. The next medication is called hydroxyzine. Once again, this is a gentle medicine. It's safe, it's not addictive, it's a cousin of Benadryl, if that gives you an idea of what it's like. But because it's an antihistamine, it's a good choice for people who also have allergies. The other indication to give this medication is if someone has anxiety. So the medication has been around since the 1950s. It's safe, not expensive, not addictive. I prescribe this one a lot, and just from the feedback from patients, most people like it, but sometimes people complain of a little next day sluggishness. But again, this might make sense for you if you also have allergies and anxiety. Now, lately, I've gotten into the habit of prescribing both hydroxyzine and trazodone just together as the first medicines to try. And I tell people, take one for a week, see how you feel, and then switch over to the other one and let us know which ones work better. The reason I do this is because I found that about 80% of the people will like one of them, but it's just hard to predict which one you'll like better. One other note on this, in order to kind of unlock the door for your insurance to pay for some of the newer, more expensive sleep medicines, they'll want to see that you've tried cheaper alternative medicines first. So by prescribing these meds right out of the gate, we're sort of checking that box. Okay, moving on to the next class of medications. This includes the medicine called Belsomra and then one called Quviviq. So these are two new kid on the block medicines. They've basically are the same medicine like Coke and Pepsi. So I'll talk about them as being the same. Belsomra has been out since 2015, but initially it was hard to get on people's insurance. It was expensive, and honestly, that's still probably the biggest drawback to this one. Even if the medicine is covered by your insurance, they may play this game where they say you have to fail two cheaper alternatives like we just talked about. All that being said, there are some coupons that we can give you that really help bring the price down on these. These medicines are great. Belsomra works in a totally different way than any of the other sleep medicines on this list, and arguably, it's probably one of the safest, especially for the elderly. The best way to conceptualize how these things work is to think about how a car is moving down the road, and we're comparing the car to your brain. If a car is moving forward, in order to slow it down, you can apply pressure to the brake, and so examples of this kind of action on the brain would be with medicines like Xanax or temazepam or alcohol, but you can also remove your foot from the accelerator, and Belsomra is like that. There have been some clinical trials that have shown this class of medicine, people usually reach a deeper stage of sleep. It's more restorative. People stay asleep better, and they actually perform higher on IQ tests. But these meds don't work quite as fast and are not hard hitting like the other ones are. Where these really shine is in keeping you to sleep. Benefits of this class include less next day hangover, less risk of falling if you were to get up at night, less feeling sedated if you have to get up to pee, for example. I'd say about 75% of the time people say it works great, but about 25% of people say even at the highest dose, it really just doesn't work for them. So a little more hit or miss here maybe. This medication is probably the best for people over the age of 65 because, again, it's not associated with falling or sedation like some of the harder hitting medicines are. And I predict that this class of medicine will probably become more and more popular as time goes on and the costs come down. Okay, switching to the next class, and now we're getting to the hard hitters, including medicines like Ambien, Lunesta, Sonata. I lump all three of these together because in my mind they're all about the same, just different brands. The one I prescribe the most is probably Ambien because it's generic and the cheapest, and it has relatively good safety profile. Ambien's been out since 1992. It went generic in 2007, became dirt cheap. At that time, it was probably the number one sleep medicine used, and the reason was because it definitely works well. It puts you to sleep, and it can almost overcome any sleep issue. It's hard-hitting, fast-acting, and the high dose is extremely effective on this. Ambien falls into a category of medicines called non-benzodiazepine sedatives. And if you want me to get fancy and technical here, it binds to the GABA A receptor in the brain. So going back to the car analogy, pushing on the GABA A receptor in the brain is like pushing on the brakes. And as a result, you're going to be sedated, you're going to be sleepy. The downside is that people can become kind of overly sedated. And in fact, it's gotten some bad press here and there. In 2015, the American Geriatric Society said you really shouldn't use that in very old people if possible, just because it could theoretically increase the fall risk if they get up in the middle of the night. And there have been some reports of people getting up at night and sort of binge eating and then not really remembering the next morning, or having a conversation with someone on the cell phone and then not remembering. But I'll give you my opinion on the bad press. I think too often this medication gets prescribed as an afterthought by doctors, and they don't really have time to explain how to take it and what to look out for. So if you take this medicine and you're going to stay up and eat something and watch a movie and you don't immediately try to go to bed, then yeah, you're going to act kind of cuckoo. That's why I tell people, and I'm telling you right now, if you take this medication, you literally need to take it right before you go to bed and then stay there. No phone calls, no getting up for a snack, just lights off, TV off, and eyes closed. It starts working in about 10 or 15 minutes, and I'm not kidding around here. The other thing to know is that it works better on an empty stomach, so I guess no snacking. But if you follow those rules, this one is great. I mean, it's like being hit in the head with a tack hammer. It's going to put you to sleep. Ambien is engineered to metabolize out of your system in about 6 hours, so expect 6 hours of good solid sleep. I think there's probably less next day sedation, fogginess in this class, but again, everyone's different. More than any other of the meds we've talked about on the list, this class is really not supposed to be used every day. It's not addictive, meaning that if you stopped it suddenly, it's not like you're going to withdraw, but you might become kind of dependent on it, meaning that if you take it every day for months and years, it's hard to get a good night's sleep without it, type of thing. So I would say the best way to take this class is to use it in short bursts, maybe like a week at a time, just to sort of reestablish a good sleep pattern and get your body used to going to bed at the same time every night. I think that most people do fine on this medication. Again, you just have to remember sort of the rules that we talked about. Take it right before you go to sleep, eyes shut, and then go to bed. Okay, that's it. I hope you've learned a lot from this video and have the knowledge now to make an informed decision about which of these medications is right for you. I'll be right back in the room in just a second, and we can talk more about this.